Welcome to the Genetics Podcast. I'm really excited to be here today with Steff Di Pardo. She is a writer, blogger, and a patient advocate. So Steff developed an autoimmune condition called Ankylosing spondylitis around age 21. As a result, she had to quit her job. In her words, she was bedridden for 3 months. I think it took about a year to actually get a diagnosis definitively of ankylosing spondylitis. But when she was 21 and originally started experiencing symptoms, she started to blog, posting on Facebook and Instagram about her experience. And since then, it's really snowballed into writing across a number of different platforms, her own social media. She wrote a guest blog on our blog posts, and she also writes regularly on the Health Union blog. So first of all, I'd just like to say welcome, Steff, and thanks so much for taking the time to be here.
Hi, thank you so much for having me.
So I've read a lot of your writing on your personal blog, Totally Chronic, totallychronic.com, which is I think an amazing name and URL, by the way, as well as some of the Health Union writing. And obviously, I think, first of all, you're a great writer, but you're also really an open book about your experiences, which I think is really refreshing. And it's powerful because people can connect with you and they get an unfiltered version of you. So I was wondering if maybe you could start by just telling us about your experience with ankylosing spondylitis. What was it like at age 21 when you started to develop symptoms, and then when you started to actually write about your experience?
Yeah, so when I first developed it, I woke up one day and my hip was in a lot of pain. I started limping, and I didn't really think anything of it. I thought, I'll just kind of walk it off, some random pain, who knows what it is. And then about 2 weeks later, I'm working the whole time, and it's progressively just getting worse and worse. My manager comes up to me and she says, "Hey, Steff, we can tell you're in a lot of pain. You need to go to the doctor. We'll give you the time off. You need to go check it out." And I did the next day, and I never went back to work because that started the whole journey. The walk-in doctor I went to didn't know what was going on. Gave me a couple days off work, but I knew I would need more. Became bedridden completely, apart from doctor's appointments. And that's when I started to post on Facebook about what was going on with my life and medically, and just kind of wanted to share with my friends and family what I was going through. And over the course of a few months, I would get comments like, "Steff, this is amazing. You almost made me cry. You're such an amazing writer." And I kind of took that, and I was like, maybe I should blog about it, make a website for those who are kind of going through something similar or maybe don't know what's going on. And so in November of 2018, I started my website, and it kind of just took off from there.
Great. So you got a lot of positive feedback from your friends and family. You started initially on Facebook. How long was it before you decided to actually start your own blog?
It was about a year and a half, I'd say.
Okay. And in that time period, I guess you got your diagnosis, because I think you said in one of your previous blog posts that it took you about 1 year to get a diagnosis, which you said felt like a lifetime, even though for others affected by ankylosing spondylitis, it can take 8 years, 10 years, even longer. So tell me about that. How did you actually get the diagnosis, and why does it take so long for most people, like you? Frankly, a year is a really long time to get diagnosed.
In Canada, we have free healthcare, but we have a lot of wait time. So to see a rheumatologist, it took me 6 months. And then from there, he had to do a bunch of testing, which also took a lot of waiting. I also saw neurologists in that time. We got referred to neurosurgeons who didn't want to see me because it wasn't related. And so it took me 6 months to see the rheumatologist. And then I got an MRI, blood work, x-rays, and then 4 months later, got diagnosed.
Why did they have you seeing a neurologist? Was there some concern that it might have been some kind of nerve damage or something like that? Was it clear to you? I mean, some people start to do their own research. Did you feel like you diagnosed yourself before you actually got a diagnosis, or was that year period really kind of confusing and disorienting in terms of what was happening?
It was really confusing for me because the first MRI I got, I had some cysts around the bottom of my spine. So that's why they thought it was neurological. But yeah, so I thought, okay, it's related to that then. That's the only answers we were getting. And then when the neurologists were like, nope, you seem totally fine, there shouldn't be anything going on, I was like, okay, what's actually happening here?
What has been the biggest unexpected result of your writing and blogging? It seems like from the beginning you had a lot of people reaching out and saying that it was emotionally moving or touching, or probably helped them understand a little bit more about what you were going through. What other things came out of it that you weren't expecting from the beginning?
I definitely wasn't expecting all of the feedback and people reaching out. That really means a lot to me, and like the positive comments. And I got a comment from a mother whose son had it, who said, my son has AS and I finally understand it now, which means so much to me. And I wasn't expecting all of that at the beginning. I just thought, if I help one person, that's all I want. So I get almost messages on the daily from people saying, like, I found your blog, I found your Instagram, and it's amazing, honestly.
That's so great. How do you know about how common AS is? Because it strikes me as I know a little bit about it because we're supporting some research in the area here at Sono, and it falls in the category of common enough that many people are affected by it, but rare enough that it's not the first thing anyone suspects, and there's also actually not that much information about it in many cases. So probably blogs like yours are one of the first things that people come across when they've been diagnosed for the first time. How common is it? Do you know?
I'm not exactly sure, but we do have a support group in my area, and there's a good chunk of us, so it's not super uncommon.
Yeah, I think it's probably in the one in 100 to 1 in 1,000 people kind of range, right? But because it's challenging to diagnose, I imagine there are a lot of people out there who maybe aren't getting the healthcare that they need, or getting diagnoses quickly enough. And sometimes people like you can actually help people to orient themselves towards a support network and find those kinds of things. Have you engaged with other kinds of online patient forums or groups, things like Health Unlocked or Patients Like Me or others come to mind that we've had someone on the podcast before, Paul Wicks from Patients Like Me, talk about how transformative those groups can be for people to kind of build a peer support network. Has that ever been an outlet for you, or have you focused on writing primarily?
I actually haven't heard of any of those, so that's right. Interesting. Just mostly the writing for me.
Yeah. So I'd love to hear more about your book. You recently published a book called Just Breathe. How did that come about? And is it a culmination of some of your writing over the last few years, or is it entirely new? What's it all about?
So Just Breathe, it came about, one of my friends was like, you know what, you should write a book. And I was like, that's my biggest goal. Like, I would love to write a book someday, but I was like, oh, it'll never happen, or like it'll happen years from now. And she was like, you can self-publish with Amazon. And I was like, oh my gosh, this is an actual possibility now. So I just kind of started writing back in January, and I couldn't stop. It's like my articles, but a bit longer. So it's just short essays on different topics of my life. And I just couldn't stop writing, and I published it at the end of March.
Amazing. How can people find it? It's on your website, obviously, and I guess you can order it through Amazon.
Yeah, through Amazon.
One of the things that I noticed you've covered a lot in your writing is the mental health aspects of chronic disease. Obviously, there's a physical aspect with AS of joint and spine pain, but obviously the mental part is often overlooked by healthcare professionals. I wonder if we could talk a little bit more about that and why you choose to focus on that in some of your writing.
Yeah, so I've had chronic depression since I was 16, so it's not new to me, but the topic of having it with chronic pain and chronic illness is newer. And I know how important mental illness is because I've had it for so long and it runs in my family. So just writing about it and not being secretive about it, I think is so important. And it shows a whole other side of chronic illness to people who don't have it.
Yeah, because the two are related, right? It's there's a feedback loop that is often, I think it's often not considered strongly enough in the healthcare system, traditionally speaking, right? We tend to focus on treating the physical aspects, but often overlook the mental aspects that can be a result of the physical aspects, or that can compound and add. Has that been your experience? I'm not sure how the Canadian healthcare system is from a mental health perspective, but I know here in the UK and in the US, there's certainly a lot of room to improve in that area.
Mm-hmm. Yeah, for sure. I've only done government covered therapy, which again, the wait times are very long. I think I waited about 6 months to see my first psychiatrist. So it's definitely, there's room to improve.
We had a question from Hannah Thompson, who was wondering if one of her friends developed ankylosing spondylitis, what can she do to help, or what should she say? And obviously it's different depending on the relationship to the friend, but how do you support someone in your family or friend network that's diagnosed with a chronic condition, and you know, being a good friend, good supporter or ally?
I think personally for me, the best thing to do is just to listen and let your friend vent. Let them get out what's going on. You don't have to fix their problems because you're not a doctor. There's oftentimes not much to fix. It's just learning how to deal with it and learning how to live with it. So my biggest piece of advice is to just listen and be sympathetic to them.
That's great. I think that's good advice. I was wondering if from a research perspective, you have any advice to offer researchers. I think one topic we discuss a lot on this podcast is that how researchers don't always have all the answers. And often if you ask patients, then they'll tell you what to focus on. And it can be very different from what researchers think is what should be focused on. I wonder if you have any perspective on that. If there are things that you feel like researchers should be doing that they aren't doing currently.
I'm not super familiar with the research on AS, to be honest.
That's fair enough. But what are the things that you wish what are the things that you wish healthcare or the access that you have to rheumatology did better that it doesn't have, that was maybe didn't meet the expectations that you had from the start?
Something that I find with my rheumatologist is it's always very rushed. I can't really talk about everything I'm going through because it's just go, go, go all the time. So again, with the listening, it's important to listen to the patients that go through it every day and know what they're talking about.
Yeah, absolutely. How has that changed at all due to COVID? What I've heard from some clinicians on Twitter and personal conversations is that because they have Zoom meetings now, they have often a little bit more time because there's none of the administrative things of walking around, and you can go from a 10-minute meeting with 5 minutes of admin on either side to maybe a slightly longer 20-minute meeting. Has that been your experience at all, or has it been different?
That's really interesting because mine is the complete opposite.
Interesting.
Yeah, I talked to my rheumatologist about a month ago, and it was even more rushed. It was about a 2-minute phone call. And it was just
because they're just scheduled back to back all day and 10-minute phone calls. Do you find that you then turn to your writing or other patients or experts to get that outlet because you don't necessarily have that from the rheumatologist?
Yeah, I definitely find I'm asking people on Instagram a lot, like, oh, do you have anything that helps with fatigue? Or like, what do you do when this happens? So yeah, I turn to other patients.
Yeah, I'd like to ask you more about Instagram. Because I'm only 29 years old, so I have an Instagram, and I'm not very active, but I think researchers in general probably don't embrace or understand Instagram, in probably the way that we should. And I think there's a lot to be said about how we engage people in research and how we better communicate new information out. What has your experience been on Instagram as an outlet for connecting with other patients or advocating? How's it different than Facebook? How's it different than blogs or than your interaction with maybe the traditional healthcare system that I think is very far from Instagram in terms of embracing technology?
Yeah, it's been amazing, my experience on Instagram. I get messages from people in India, South America, the UK, like everywhere. And we all are going through the same thing. And it's amazing to just talk to people that are going through the same thing and know exactly how you're feeling. Because you can't find that all the time in real life with your friends. They don't really know what you're going through. So I've made a lot of friends, and they've helped me a lot through Instagram, just mentally too.
How do they find you? Do they find you via one of the hashtags that you use, or via your blog? And then what happens after that? They send you a DM, or do you have a private group of people that you kind of are close to and chat with? How does it actually work? Because I think people are familiar with the concept of a Facebook group, and there are very large Facebook groups that are started by patient advocates or groups of patients. But I'm not sure how it really works on Instagram, because it's much more of a public forum, right? You can create private groups, but it's not really the same in the way that it is on Facebook.
Mm-hmm. Yeah, so I mostly use hashtags on all of my posts. And that's how I'm found a lot of the times, or through my website, but I'd say the hashtags more. And then they just send me a private message, like a DM, and just tell me, like, I found you going through exactly what you're going through. Like, do you have advice for this? Or like, I just started a new drug, and I get a lot of messages about Humira and stuff like that.
Right. I noticed that on your blog, and I was curious how that works. I'm not affected by AS, so I'm relatively new to to how it actually works operationally from a treatment perspective. Was that the first treatment that you tried, or was it one of a very long line? And how did you actually approach determining whether you want to take an injectable biologic drug or one of the other options available?
Yeah, so Humira is my second. I was on Remicade first, and that's through the IV. It worked for a good year, and then I'd say the second year I was on it, it just kind of progressively got less and less effective. So I talked to my doctor, and he actually wanted to keep me on Remicade, and I asked if I could try Humira because I've seen the commercials and I've seen people do it, and I figured, especially with COVID going on, this would be a lot easier. So I just get it delivered to my house, and I just do it every other week.
So how does Remicade work? You said it's an IV. So so do you have to actually go to the doctors periodically?
Yeah, I used to go. It starts every 8 weeks, and then I had to go down to every 4 weeks because it stopped working for me.
How common is that in terms of an experience for other people like you? Do you hear a lot of people having the same experience, that something like Remicade works for a period of time and then it stops? Did you get any understanding from people why that is, or what's driving that? It seems to me like a really frustrating proposition that every couple of years you have to look for something else because for whatever reason your body learns to I don't even know what's happening on a biological level, but it's you probably need higher and higher dose to achieve the same effect, I imagine. And at some point it becomes unsafe. Is that right? Yeah.
Yeah. So I do find a lot of people start with the injectables and they just go through 3 or 4 of them until they find the one that works. So it is pretty common just to keep going through them every so often.
it seems like a frustrating process, but you write about this a lot. To some extent, it becomes part of it. You grow used to it, right? Like you've written in your writing before that it becomes a part of you, and it you know that you're in it for the long haul, right? This is part of your identity, and you own it, and you're very you're very open and honest about how your experiences are. So I think there's a level of resilience there that you build that probably other people don't, because they don't have that experience. Right.
Yeah. I've just kind of, I don't know when it happened in my journey, but I just kind of thought to myself, like, okay, this is your life now. So you just got to get used to it. And this is what's going to happen. You're going to have hardships. You're going to have easier days. And that's just how it is.
Yeah, absolutely. So to kind of close up here, in terms of what's next for you, obviously you've written one book, you're continuing to blog, you're active on Instagram and probably growing the impact that you have substantially. What is the next 5, 10, 15 years hold for you? What are you, I think are you 25, 26 now? So you've got your whole career ahead of you. What are you most excited about, and what's next?
Next for me, I would love to write a full-length book with a publisher. So that's kind of what I'm working towards next. Finding a publisher, writing my next book, and just kind of continuing what I'm doing.
Amazing.
I love helping others.
What do you want to write your next book about? Do you have a topic or a title? I don't know if that's how it works. Do you start with you probably don't start with the title.
No. What it's going to be about is basically just what I'm going through, but I just want to write more about it and in more depth and detail, almost being more open and honest about it.
That seems to be a theme that's coming through.
Yes.
That's great. Well, thank you. I mean, I think your honesty is powerful, and it's really refreshing. I've enjoyed reading some of your work, and it sounds like other people do too. I think it's times are changing in terms of the way people engage with their health, and with new research and things like that. And I just think it's really great that there are people like you that are taking their story and using it to help and inspire and teach others. So thanks so much for taking the time to be part of this.
Yeah, thank you so much for having me. Awesome. Great.
If people want to follow you or keep up with your work, your website's totallychronic.com. I think on Instagram you're totally funkless.
Yes.
Where does that come from?
That actually just came from a movie I watched like years ago. It's just a line from a movie.
Yeah. Well, I guess your book can be totally something. That would be a good book title. Put that one out there. Well, great. Thanks, Steff. I really appreciate it. And enjoy the rest of your day. I know you're just getting started in Canada.
Yeah, thanks so much.